Okay, now we're going to visualize clinical presentation. So we start with the clinical presentation of birth asphyxia. Now, for the clinical presentation of birth asphyxia, we need to evaluate the fact that what? Birth asphyxia diagnosis is going to be based on the Apgar score. So the diagnosis of birth asphyxia is going to be based on the Apgar score. You need to know that what, based on this Apgar score, you can classify birth asphyxia into mild, moderate, and severe birth asphyxia. Now, for mild birth asphyxia is when the Apgar score is 0 to 3. For moderate birth asphyxia is when the Apgar score is going to be 4 to 5. I just made a mistake. For the severe birth asphyxia is when the Apgar score is going to be 0 to 3. For the moderate birth asphyxia is when the Apgar score is going to be 4 to 5, and for the mild birth asphyxia is going to be 6 to 7. So generally, that is how you visualize the Apgar score and the severity. So if you have an Apgar between 0 to 3, is going to be severe, moderate is going to be 4 to 5, and then mild is going to be 6 to 7. When you have Apgar score of 8, 9, 10, they are considered to be normal. And when you have what is the relevance of the Apgar score? Apgar score is going to be taken at the first minute, it's going to be taken at the 5th minute, and it's going to be taken at the 10th minute. The Apgar score taken at the first minute is going to just tell you the state of the child, is it clear? The state of the life of the child, is it clear? The Apgar score at the 5th minute tells you the adaptation to the extrauterine life of the child. Is it clear? When you have adaptation to extrauterine life, is the Apgar score of the 5th minute, and the Apgar score at the 10th minute is going to tell you the prognosis. Is it clear? If there is high risk of hypoxic ischemic encephalopathy and all those other complications. Is it clear? So those are the elements of the Apgar score. Now, the next thing you're going to ask me is how do you make the Apgar score? So there are different elements. The Apgar score is going to be generally divided based on the mnemonics A, P, G, A, R. A for the appearance, and each of them is going to be from 0, 1, 2. So we are going to have the appearance, we are going to have the pulsatility or the pulse, we have the grimace, we have the activity, and then we have the reflexes. Now, for the appearance, if the child is completely pale or blue, the Apgar score is 0, complete pale or blue. If the child is pale or blue at the extremities, the Apgar score is going to be 1. And if the child is completely pink, the Apgar score is going to be 2. For the pulsatility, if the heart rate is 0, the Apgar score is 0. If the heart rate is greater than 100, the Apgar score is 1. And if the Apgar score is greater than 100, if the pulse is greater than 100, Apgar score is greater than 2. Now for the grimace, when you are doing aspiration and there is no grimace, is 0. If there is grimace and the child does not cry, is 1. If there is grimace and the child cries vigorously, is 2. For the activity, the child is going to be floppy, meaning that there is no contraction of the upper and lower limb. If there is contraction of only the upper or lower limb, it is going to be 1. And if there is contraction of both upper and lower limb with activity, there is going to be 2. The reflexes, the last one is respiration, is not reflexes. Respiration is if the child does not cry, no cry is 0. If the child cries but is not vigorous, it is 1. And if the child cries vigorously, it is 2. So those are the different elements of the Apgar score. And based on these elements, now you can make a diagnosis of the birth asphyxia. Is it clear? And when you make a diagnosis of the birth asphyxia, now you need to go to the pathophysiologists. With birth asphyxia, the diagnosis is going to be made on your labor history, that you're going to have the Apgar score, and you have the resuscitation that are being done based on that. You need to know that generally, if a child comes out, is it clear, you are going to have resuscitation of the child that is going to be done. Is it clear? And that resuscitation of the child I'm going to speak about in the management. Now, the next element the next element after that, you need to evaluate now. You need to know that what a child that has also birth asphyxia, you need to know that there is going to be also acidosis, and the major point that is going to show acidosis is going to be a respiratory distress. Is it clear? Acidosis is also a major element in diagnosis of birth asphyxia, and it's going to be shown by respiratory distress. And how do you evaluate respiratory distress? You can evaluate respiratory distress with the Silverman-Anderson score. Is it clear? The Silverman-Anderson score, and the Silverman-Anderson score is divided into still shows from 0, 1, 2, and the lesser the Silverman-Anderson, contrary to the Apgar score, the good, the better the prognosis. So if you have the first is going to be nasal flaring. Is it clear? The second is going to be chest movement. The third is going to be intercostal recession. The fourth is going to be the subcostal recession or the xiphoid recession, and the fifth is going to be grunting. So those are the five elements of the Silverman-Anderson. Scale is going to be measured to 10. Nasal flaring, if there is no nasal flaring, is 0. If there is mild nasal flaring, is 1, mild, and if there is marked nasal flaring, is 2. For the chest movement, if the chest moves with the abdomen, it is 0. If the abdomen lack behind the chest, or the chest lack behind the abdomen, it is 1. And if there is a seesaw movement, is it clear? A seesaw movement, it is 2. The next one is intercostal recession. If there is a intercostal recession, there is no intercostal recession, is 0. If there is mild intercostal recession, is 1, and if there is marked intercostal recession, is going to be 2. For the subcostal or the xiphoid recession, if there is no xiphoid recession, is 0. If there is mild, is 1. And if there is marked, is going to be 2. For the grunting, if there is no grunting, is 0. If there is grunting with the stethoscope, on the stethoscope, is going to be 1, and if there is marked grunting, is going to be 2. Is it clear? So those are the different elements that you have to evaluate when you want to make a diagnosis of the birth asphyxia.